The COVID-19 pandemic is generating suffering and damage in every region. It poses a far-reaching threat to human rights. We do not know how the virus might evolve, or whether those affected will permanently be immune. We do not have complete data of who is being infected and developing the most severe symptoms, or whether there are links to contributory factors such as pollution. We do know that vital measures must be taken to upgrade health and social systems to ensure the greatest possible support to those most impacted by the epidemic. We know we cannot afford to leave anyone behind in this effort. And we know that lockdowns cannot continue forever. Exit strategies must be carefully devised to ensure our societies and people recover. This is a global pandemic, and only global solidarity will ensure that we can combat it effectively. This crisis makes clear how much we need collective international action and demonstrates the value of our multilateral organizations. The United Nations was created to prevent, mitigate, and more effectively address international crises. I urge all of us to work together to promote a strong multilateral, cooperative, and global approach. The pandemic is exposing the damaging impact of inequalities in every society. In developed countries, fault lines in access to health care, in labor rights and social protection, in living space and in dignity are suddenly very visible. In developing countries, where a large portion of the population may rely on daily income to survive, the impact could be far greater. The million of people who have little access to health care and who by necessity live in cramped conditions with poor sanitation, no safety net, no clean water, will suffer most. They are less likely to be able to protect themselves from the virus and less likely to withstand a sharp drop in income. Unchecked, the pandemic is likely to create even wider inequalities and amid extensive suffering. The universality of the threat from this virus provides the most compelling argument there has been ever for universal and affordable access to health care. Actions to upgrade public health care in every country are especially urgent. WHO is leading efforts to ensure that all countries are equipped to trace, isolate, and treat people infected by COVID-19. This effort should be fully resourced. There will need to be a significant regional and global efforts to avoid the collapse of any country's medical system, a matter of urgent interest to everyone. Extensive economic and social measures must also be taken in every country to lessen the shocks of this epidemic and minimize the further growth of inequalities. The full impact of the pandemic on global and national economies has yet to be felt. Many states in every region, especially in Europe, have taken unprecedented measures to protect the right of workers and minimize the numbers of those made unemployed. All states with sufficient resources should be encouraged to do the same. WHO strongly advises that health and social measures to combat COVID-19 be implemented with the full engagement of the public, because respect for human rights, including the right to speak up and to meaningfully participate in decisions, is an essential lever of successful public health policies. The only effective way to fight an epidemic is with the public's trust. All national efforts should seek to mitigate the impact of the epidemic on women and on vulnerable groups. Confinement measures are creating additional burdens for many women, including the burden of caring for the sick, the elderly, and with children no longer attending school. People with disabilities must often rely on others for help with daily tasks, and confinement regulations should ensure that support is available. Extensive measures must be taken in every country to absorb the economic and social shocks of this epidemic and to minimize the expansion of inequalities. Everywhere, the pandemic is likely to take a disproportionate toll on the poor. There is a strong need for governmental action to ensure income security, the protection of livelihood, and access to essential goods and services for the poorest members of the society. It is vital to prevent people from becoming homeless as a result of losing their jobs. We simply cannot return to where we were just a few months ago before COVID-19. This is a colossal test of leadership. It demands decisive, coordinated, and innovative action from all, for all. From all and for all. We are physically distant today, but we must stand together.